I see that it is the top of the hour wherever you happen to be. If it's 2 p.m. Eastern or you're in a different time zone, I'd like to thank you all for joining us today. My name is Miranda Kennedy. I'm the director of the Able National Resource Center. In today's webinar, the topic is increasing Able savings through employment during COVID-19. We'd like to thank our sponsor, our funder. We are funded, the Able National Resource Center is funded through a grant from Prudential. And before we get started with the content of our webinar today, I'm going to hand things over to our project coordinator, Hope Price, to just walk us through some of the webinar logistics, make sure everyone is set and ready to go as we head into our webinar. So Hope, take it away.
Thank you, Miranda. For listening to today's webinar, the audio for today's meeting can be accessed using computer audio or by calling in by phone. If you select computer audio, please make sure your speakers are turned on or your headphones are plugged in. If you do not have sound capabilities on your computer or prefer to listen by phone, please dial 1-929-205-6099 and add in meeting code 878-7474-1721. For captioning, real-time captioning is provided during this webinar. The captions can be found by clicking on the closed caption icon in your Zoom controls at the bottom of the screen. If you do not see the captions after clicking the button, please alert the host via the chat box, and you may also view captions in your browser at www.streamtext.net/player?event=NDI. For submitting questions, please use the Q&A box to submit any questions you have during the webinar. We will try to answer all questions. If your question is not answered during the webinar, or if you are listening by phone and not logged in, please visit www.ablenrc.org. For technical assistance, if you experience any technical difficulties during the webinar, please use the chat box to send a message to the NDI host, or you may email me, Hope Price, at hprice@ndi-inc.org. Please note this webinar is being recorded and the materials will be placed on the Able National Resource Center website, along with all of our other Able webinars at ablenrc.org/resources/webinars. Thank you, Miranda. Back to you.
Thank you, Hope. Let's go ahead and take a look at our agenda for today. So if we go to the next slide, you'll see we're going to start off by introducing our presenters. I'm going to share with you some information and background on the 3 presenters we have, which I think will help you understand why I'm going to be sharing that information, because we've got a great group with us today, and we're going to really dive into this topic. We'll also, for those of you who may be new to us or would appreciate a refresher, we'll share a little bit of information and background about Able National Resource Center and what we can provide to provide some context. Then we'll be touching base on National Disability Employment Awareness Month and what NDEAM is all about. That's the focus of our topic here today on employment. Then we're going to be diving into Able basics, and we'll be hearing from a subject matter expert on that topic, give people a good foundation and background, and then how that layers into employment, work incentives, and savings opportunities, and how these things come together. And then we're going to be providing at the end, and throughout as well, resources so that you can learn more about Able accounts and how Able accounts can support employment goals. So with that, let's go ahead and take a look at who our presenters are for today. And I'll start off by introducing myself. My name is Miranda Kennedy, and while I've been the director of the Able National Resource Center for a bit more than 2 years now, for the 12 years before that, I was the director of training for the U.S. Department of Labor's National Disability Employment Initiative, and before that, their Disability Program Navigator Initiative within the workforce system. So many years ago, before all of that, I had worked at the local and state levels here in Colorado where I live with the workforce system and with partners such as vocational rehabilitation, helping to get people with disabilities the training and accommodations and supports they need to secure competitive integrated employment outcomes. As someone with a disability who needs reasonable accommodations to be able to work at the level that I do myself, this topic is near and dear to me, as I know it is to my fellow presenters here today and to all of you who are here with us. Now I'd like to introduce my colleague, Lori Schaller, who's a manager of financial empowerment at National Disability Institute. Lori manages the NDI Assistive Technology Loan Program in New Jersey and New York, where she lives. She also serves as a subject matter expert on the public workforce system, Social Security disability benefits planning, and financial education and coaching. She's also a subject matter expert on ABLE accounts. Before joining NDI, Lori was a credit and housing counselor who directed a micro lending program. She also served as a navigator with the New York State of Health Marketplace, and she worked as a disability resource coordinator for the state of New York under their Disability Employment Initiative, and I happen to be her technical assistance liaison on that project. Importantly, Lori is certified as a community work incentives counselor and holds a Bachelor of Arts in Community and Human Services from Empire State College. So we're in great hands with Lori on today's presentation. And in addition to myself, she's the one you'll really be hearing going into the details on ABLE accounts and breaking down ABLE's connection and significance as it relates to employment. We're also going to be hearing from Tim Elliott, who is one of our 2020 ABLE NRC ambassadors. A disabled veteran having served in the U.S. Navy as an aviation electronics technician, Tim is now a program outreach specialist for New York's Office for People with Developmental Disabilities. Tim is not only a fierce promoter of ABLE accounts for the population he serves, he is also an ABLE account owner. Tim was a HUD housing counselor for the Office of Housing Initiatives and Supports for OPWDD, where he taught first-time home buyer classes and does credit and budget counseling. He served for 2 years as a member and team leader of Self-Advocacy AmeriCorps and worked as a project specialist organizer for the Self-Advocacy Association of New York State, teaching Medicaid buy-in, self-determination, circle of support, and person-centered planning. He currently works as a grassroots presenter as well. And he's worked as a startup and support broker for OPWDD in self-determination, assisting individuals with developmental disabilities develop life plans. He's an accomplished public speaker who uses his own experience as a person with a disability to help others understand the issues and challenges people face and the benefits and work incentives available to support them. So in addition to hearing from Tim today, you can also read more about Tim's story, including a blog he wrote for us recently on our ablenrc.org website. We also have our final presenter who's joining us today, and you're going to be hearing from her at the end, Kathy DeAngelo, who is a certified benefits and work incentive planner, just like Lori. She works for Chenango, Delaware Otsego, also known as CDO Workforce in upstate New York, providing advocacy for Social Security beneficiaries seeking assistance in the return to work. Kathy's worked in positions both at the Department of Social Services and at Otsego County Office of Employment and Training. And this has really cultivated her in her developing a unique perspective, leading to her nationally recognized success in the role of Disability Resource Coordinator and Senior Employment and Training Counselor. She's worked as a social welfare examiner, determining eligibility for temporary assistance for needy families and food stamps, and helped her first learn the complexities of low-income households and how families with adults with disabilities were often trapped in a life cycle of poverty. She became an employment counselor and has worked as a disability professional, advocating and teaching individuals how to move from dreaming about a better life to taking the steps to make it better. Her employer, CDO Workforce, has become one of the leading agencies in the U.S. Department of Labor's Disability Employment Initiative, enrolling Social Security Administration's Ticket to Work participants and moving beneficiaries off of Social Security payments and into stronger financial stability. Now, full disclosure for our listeners, I worked closely with Kathy from 2010 until I came over to the ABLE NRC in 2018. I was actually her trainer, along with Lori, serving as the liaison for the New York State Disability Employment Initiative. Although I have to admit that I'm pretty sure I've learned more from both Kathy and Lori than they ever learned from me. So in addition to hearing from Kathy's experience at the end of today's 75-minute webinar, be sure to stay until the end of that 75 minutes. But you can also check out the podcast that Kathy did with us for our Able to Save month in August. So that was quite a bit about our presenters, but I really wanted everyone to know, these are great folks. You're going to want to hear what they have to say and what they have to share. So with that, if we could go to the next slide, and we'll give a quick overview about Able National Resource Center. So the Able National Resource Center is the leading comprehensive source of objective, independent information about federal and state-related ABLE plans and activities, including guidance on tax-advantaged ABLE savings accounts. It's our mission to educate and promote and support the positive impact ABLE can make on the lives of millions of Americans with disabilities and their families. Our pioneering work in this area and subject matter expertise makes us the foremost authority on topics related to the Achieving a Better Life Experience, or ABLE Act, ABLE accounts, state ABLE programs, ABLE-related policy developments, and comprehensive integration of ABLE and financial capability strategies for people with disabilities into public service delivery systems, as you'll hear Kathy and Tim and Lori talk about. Our website is www.ablenrc.org. I do want to mention, we've been founded and we've been managed by National Disability Institute, NDI, since 2015. And National Disability Institute is the only national nonprofit focused entirely on increasing the financial capability of people with disabilities. The ABLE NRC's website has become the go-to source for all information on ABLE for people with disabilities and their families, as well as employers, state and federal agencies, service providers, tax practitioners, and financial planners and attorneys. If we go to the next slide, you can see our homepage there. There's a screenshot of our homepage. And our website's very content rich. We just launched our new website last September, and we're adding to it all the time. Something I do want everyone to know is that the ABLE National Resource Center is a privately owned website. It's not affiliated with the U.S. federal government. And while we provide a wealth of targeted resources and best practice guidance to support your use of ABLE accounts, our staff does not provide case management on Social Security benefits or advice about investing in specific ABLE programs. Our website is very searchable, and there's a lot of great information on that. In fact, if we go to the next slide, you'll see a roadmap. This is on our website. These are 2 links for those folks who might be just getting started trying to figure out even what is ABLE, who's eligible, how can funds be used, how do I open an account, how do I manage my account. That's going to be the roadmap to enrollment we have there. And at the end of that roadmap, it'll take you to our program tools to help you decide, inform you around the directions you might want to go in terms of opening an account. I do want to note here, because this is important, ABLE National Resource Center does not manage or issue ABLE accounts directly. We're a resource center. We share best practices. But in terms of those ABLE programs, we do work with state ABLE programs to ensure that information contained in our tools and resources is updated regularly. Those tools to help evaluate and assess the ABLE program that might help you best meet your needs. Those are really some of the great tools we have on our website. We have a lot of really great tools, but those beginner tools can be very helpful with 45 ABLE programs out there. We do monitor the resources there closely and update those with the individual state ABLE programs, but I just wanted to make note of that. The roadmap to independence, which is the second roadmap you see there, that's once folks have opened an ABLE account, how do you get the best benefit out of it? So that roadmap can help you move through that as well. There's a lot of other resources on our website, but I wanted to point that one out in particular. If we go to the next slide, you'll see these are the faces of our 2020 ABLE NRC ambassadors, and you can read their stories. These are ABLE account owners. We also have a few family members of ABLE account owners, and there's a diversity of goals and life stories behind these folks. And you can also check out on the next slide, here's some more great faces from the last 2 years of ABLE ambassadors when we started our ABLE ambassador program. of additional account owners and family members and the links to their stories as well. And I just feel like that's a great way to get started and show you, some real faces. We weave these into our presentations. It makes them very engaging for us even, and we include their voices as well. And actually, if you'd gone back to the last slide, you'd see Tim's face on there. But let's move forward and talk about what is National Disability Employment Awareness Month, because that is what is happening here in October. And that is the theme of our webinar here today. And if we take a look at the slide that covers INDEEM, you'll see, so U.S. Department of Labor and the Office of Disability Employment Policy are the ones who celebrate disability employment through National Disability Employment Awareness Month, also known as INDEEM. And if you go to the next slide, INDEEM celebrates America's workers with disabilities and emphasizes the importance of inclusive policies and practices to ensure that all Americans who want to work can work and who have access to services and supports to enable them to do so. So this year marks not only the 75th observance of INDEEM, but also the 30th anniversary of the Americans with Disabilities Act. President Trump issued a proclamation stating, "Together we will continue to advance and promote an inclusive workforce in which everyone can provide for themselves and their families, achieve the American dream, and enjoy the prosperity of our great nation." So the Americans with Disabilities Act is landmark civil rights legislation, as I'm sure you know, that really works to increase access and opportunity for people with disabilities across society, including in the workplace. So both milestones are being commemorated and centered on the theme, increasing access and opportunity. And with that, let's take a look at some data on working age people with disabilities, just to get us all on the same page. Americans with disabilities make up an estimated 20% of the US population, 40 to 57 million people. Many people with disabilities live at or near the poverty level. 1 in 5 families have a family member with a disability, and of those, 35%, or 22 million working age adults, have disabilities between the ages of 16 and 64. Working age adults with disabilities are twice as likely to live in poverty than those without disabilities. And a major cause of poverty among disability beneficiaries is the low rates of employment within the population. If we go to the next slide, we can see some new information that we had this year based on research that's been done at National Disability Institute on extra costs of living with a disability. Households containing an adult with a work disability require, on average, 28% more income, or an additional $17,750 a year at the median household income to obtain the same standard of living as a comparable household without a member with a disability. And we can go further and share that according to a 2019 NDI analysis of the US Census Bureau survey of income and program participant microdata, across all racial ethnic groups, households with a disabled working age householder have lower net worth compared to households without a disability, $14,180 versus $83,985. For households with householders who are Black and disabled, those households have the lowest net worth at $1,282. These numbers are more than deeply concerning. They're shocking and unacceptable, and we are setting the stage here with these numbers to begin talking about employment and the role ABLE accounts can play as a concrete and strategic tool to help to level the playing field and bring increased financial health and self-sufficiency to all people with disabilities, including those who are most disadvantaged. So with that, I'm going to hand things over to Lori. Why work, Lori?
Great. Thank you, Miranda. Next slide. So work provides a way to generate income that can be saved for basic needs, the basics a person must have in order to live, like food, water, clothing, and shelter. By working, a person may also have extra money for their wants, the extras a person would like to have but are not required. Work provides many intangible outcomes, such as a feeling of satisfaction or accomplishment as well. It impacts lifestyle and improves a person's health and access to health care insurance, particularly for those who receive SSI and/or SSDI benefits. People's financial futures may be enhanced through work. Next slide. All individuals who have a disability, whether they receive a public benefit or not, are encouraged to work to their fullest ability. Almost 65% of working age adults with disabilities receive benefits from at least one public benefit program. Some of the benefits are means tested, where income and resources determine whether or not a person is eligible or continues to be eligible for the benefit or program. Saving in an ABLE account does not affect most federally funded means-tested benefits. And to learn the strategies, we've provided a link below. And you can learn also about work supports and services discussed in this presentation and how that can help you to save more money in an ABLE account. And that's in our NDI FINRA information brief that was done in 2018. And ABLE basics. Next slide. So what is an ABLE account and who is eligible? An ABLE account is a Section 529A tax advantage savings and investment account owned by a person who has a disability or blindness. That person needs to have that onset of disability or blindness prior to age 26. And either they receive SSI, Supplemental Security Income, and or Social Security Disability Insurance, SSDI benefits. And that could be on that person's own work history, or perhaps they receive that because they are now a widow and they had a disability prior to age 26, or maybe they receive that as a childhood disability benefit. That individual would be eligible for an ABLE account. So if a person has not received that SSI and or SSDI benefit prior to age 26, they can approach their physician and ask for a written and signed disability certification indicating that their condition began prior to age 26. And the person just holds that on file, and the ABLE plan may ask for it, but they ask, do you have proof that you have a disability that qualifies? And should the IRS ever conduct an audit, you would want to have that on file as well. So the funds in an ABLE account will supplement and are not meant to replace other public benefits. So we're talking about like SNAP benefits, HUD, things of that nature. Next slide.
All right, Lori.
So which benefits are not affected by ABLE savings? A person can have any amount of ABLE savings and it will not affect free application for federal student aid, the FAFSA form. ABLE savings is excluded. You don't even have to list that on your application for financial aid. Housing assistance through housing and urban development programs like HUD. Supplemental nutrition and assistance programs, so that's our SNAP or food stamps. Any ABLE savings does not impact eligibility for SNAP benefits. Social Security and disability insurance, ABLE savings does not impact SSDI, any type of Medicare or Medicaid, including Medicaid waiver services. Next slide. Why the need for an ABLE account? Well, that ABLE account allows a person to save over the $2,000 resource limit for many means-tested benefit programs. The first $100,000 saved in an ABLE account is not counted as a resource by the SSI program. People who do not receive a public benefit may also qualify to open an ABLE account. So that means a person who has had a disability that began prior to age 26, but they never received SSI and or SSDI benefits, they are allowed to open an ABLE account and they can save as much as they choose within that ABLE account.
Lori?
ABLE account, yes?
We got a question in the chat that I thought would be great to address here. I know we don't address it in depth elsewhere, but that disability certification, someone was asking about that for exactly that point. What is a disability certification to help someone be eligible for an ABLE account who doesn't receive a public benefit? Could you just explain quickly what that is?
Sure. So within this next week, we are going to post a disability certification, and up to this time, most physicians just use their own letterhead, and they write a statement indicating that that person's disability began prior to age 26. It's that simple, and that physician signs off on that. Okay, so ABLE account savings can be used for qualified disability expenses. And really, the IRS and the Social Security Administration have determined what are qualified disability expenses. And some of these expenses are employment-related expenses. Next slide. An ABLE account may be used instead of or in addition to a retirement account for eligible people. State ABLE plans allow over time savings up to, so this is that ABLE plan that you choose. They allow you, depending upon which ABLE plan you choose, to save from $235,000 up to $529,000 over time. And that ABLE account, it can offer options for investing your money within that ABLE account, and that interest earned on that is tax-free. Increased savings in an ABLE account combined with working and using work incentives and tax credits, both state and federal, is one of the best tax advantage ways to accrue assets and provide for a better future. Okay, next slide. Okay, so who can open an ABLE account? Please keep in mind, many people had a disability onset prior to age 26, but now they may be age 50 or 75 or 80. They can still open that ABLE account. An ABLE account may be opened by a parent for a minor child under the age of 18 who is born with a disability or acquired a disability under the age of 26. So an ABLE account may be opened by the person who has the disability, an individual selected by that person who is eligible for an ABLE account, an agent under a power of attorney, a conservator or legal guardian, a spouse, parent, sibling, or grandparent, or now just added to this list is a representative payee. The representative payee is subject to all applicable SSA policy rules, and SSA, we understand, is reviewing their policies at this time, and we may see some changes in the near future. But we'll go into that in more depth in another presentation coming in the future. Next slide. And Miranda, I'd like to hand this off to you.
Thank you, Lori. This next section, we are covering employment, work incentives, and savings opportunities. And I wanted to, can you hear me?
Go ahead.
Yeah, I'll go ahead, and I've got down that I'm handing it back to you, but I'm happy to cover this if you'd like, Lori.
So I'll take it away. So strategies to save money regularly in an ABLE account. So this is a great pattern of behavior that each of us wants to strive for as a savings goal. That's to be able to save on a regular basis in an account. So for the ABLE account owner, they can increase their ABLE savings by using a variety of strategies. So of course they can work, and they in some cases, can save their Social Security work incentives and use their Social Security work incentives to create more of an income and save that extra income within that ABLE account. Saving additional earnings from employment under the Able to Work Act. Using tax credits such as the Savers Credit, so that person who owns an ABLE account and works, when they file their income taxes, they can ask if they are eligible for the Savers Credit and perhaps the Earned Income Tax Credit because they deposited monies into their ABLE account or because they worked and had their own earned income. And that refund can be deposited directly into the ABLE account, and it could even be split with another savings account that ABLE account owner may have at the same time as well. So saving unemployment compensation or stimulus payments under the CARES Act is also allowed within an ABLE account. So for those who receive the stimulus payments, and the person receives SSI, that is not a countable resource when that money is held outside of an ABLE account for up to 12 months. But if that person deposits that money into their ABLE account, then they can spend it any time in the future, and that will not count as a countable resource up to the SSI limit for an ABLE account savings. So educating others, such as an employer, service provider, or other third party about ABLE and allowable contributions to an ABLE account can help a person receive additional contributions made directly into their ABLE account. But please keep in mind that if an employer contributes to an ABLE account, that is countable income that may affect the person's public benefits. Next slide.
And Lori, we're getting a number of questions that are coming in, and I think this might be a good point to just address one of them that kind of covers them all. One of the questions was, there is, and we know there's some misunderstanding around that. Some folks think there's a $100,000 limit to what you can have in an ABLE account. Now, you were just talking about SSI limits and Medicaid, but the accounts actually go up to $235,000 or even up to $529,000. So there's a difference between that $100,000 and that, $529,000 mark, right? Could you explain just a little bit more about that to the folks who are writing in and asking about that piece?
Great. So if an ABLE account owner receives SSI, they are limited to saving up to $100,000 in their ABLE account, and that $100,000 is not considered into the person's countable resource limit. So we know that many SSI recipients have a $2,000 resource limit. So when the money is saved in that ABLE account up to $100,000, that is not counted towards that resource limit. But should that SSI beneficiary's ABLE account exceed $100,000, whatever amount is over $100,000 then is added with whatever other savings that individual has towards their limit of saving $2,000 as a resource. So the person then would need to spend down their money so that they go back in pay status within that next month for their benefits, unless they no longer need that benefit. So that sort of leads me one more place. So many people who work and receive SSI and or SSDI, because of their work income, they may over time, utilizing all of their work supports, come out of pay for their SSI and or SSDI. They are still allowed to save within that ABLE account. And we'll talk more about what that savings can be used for. So every ABLE plan has a savings limit. So each year, we'll go to this slide, a person can contribute up to $15,000 into an ABLE account within the calendar year. If that person has a 529 college savings account, they can roll up to $15,000 into their ABLE account as long as other monies were not contributed so far that year. So that limit for all those sort of sources is $15,000. But a person who works may contribute even more into their ABLE account from their earnings and the able to work by using Social Security employment supports. Contributions into the ABLE account do not count as income by means-tested benefit programs. An ABLE account owner's earned income, child support payments, and retirement income is still countable income for means-tested programs. Okay, next slide. Okay. This Able to Work provision was passed as part of the Tax Cuts and Jobs Act of 2017. And this is the provision that allows ABLE account owners who work and earn income to contribute above the $15,000 annual contribution limit. The beneficiary is not eligible to make the additional contributions if their employer had already contributed to a workplace retirement plan for that individual in that calendar year, or if that person themselves saved money in an employer-sponsored retirement account for this calendar year. So examples of employer-sponsored retirement accounts are 401A, 403B, 403A, and 457B eligible deferred compensation plans. So if someone has already had money contributed, maybe they want to evaluate for next year, do they want to participate in the employer-sponsored retirement account, or do they want to open an ABLE account and contribute extra money into their ABLE account for their future? For many SSI beneficiaries or Medicaid beneficiaries, retirement savings account is a countable resource. So people need to consider that when they're making that decision. Okay, next slide. The ABLE account owner may contribute earned or unearned income into an additional amount from whichever is less, their gross income for that taxable year, or the amount equal to the federal poverty level for the 48 contiguous states for a one-person household for the year prior to when the contributions are made. So let's make this simple. If you live in the continental United States and you have work earnings, from your earnings you can contribute up to an additional $12,140 this calendar year. If you live in Alaska or Hawaii, because of the federal poverty level being higher in those states, you are allowed to save additional money. That's $15,180, or for Hawaii residents, that's $13,960. And I want to apologize. I just noticed now our figure for the 48 contiguous states is not correct. That should be $12,490. So that ABLE account owner from all their friends' family can have up to $15,000 saved in that ABLE account, and from their earnings they can add up to an additional $12,490. Earnings that are the result of employment are still counted in terms of earned income or substantial gainful activity and taken into consideration when determining eligibility for certain public benefits. Okay, next slide. So what are work incentives that I've been mentioning? So they are work supports Congress intended for the SSA Work Incentives Program to provide assistance to help a person with a disability to re-enter or enter or stay in the workforce by protecting their monthly cash payments, their SSI and or SSDI benefits, Medicare and Medicaid while the person tests their ability to work. And in many cases, people, when they work, they can learn about work supports that allow for greater earnings, and the person can retain or maybe become eligible for special Medicaid programs that are designed specifically to provide medical insurance coverage to meet that person's needs as they pursue employment to their highest level and ability. The goal of the Work Incentives Program is to assist individuals to achieve gainful employment, increase independence, facilitate empowerment, and acquire self-support. Social Security pays disability-based benefits under 2 programs, and most of the work incentives are different under each program. Descriptions of all work incentives are included in Social Security's Red Book at www.ssa.gov/redbook, and you can find that information there. Next slide. What are some examples of work incentives? The trial work period and grace period, extended period of eligibility, subsidy and special conditions, impairment-related work expenses, or IRWI's extended Medicare coverage, student earned income exclusion. So when a student under the age of 22, for example, works and they receive SSI, most of their income is not counted as earned income, keeping that person in pay status longer for their SSI benefit. So we really want to encourage our youth to begin to work as soon as possible and make use of that student earned income exclusion work support. Earned income exclusion, again, for SSI beneficiaries, plan to achieve self-support. That can help a person to work, earn money, that then they save towards paying for maybe something like reliable transportation or paying for out-of-pocket college expenses, and they retain their benefit for a longer period of time while they are paying or saving for that expense to eliminate that barrier to that person working at a higher level. There's the Ticket to Work program that allows an employment network to assign a ticket, and that person is provided all kinds of supports, again, to help them work to their fullest level. There's the 1619B Continued Medicaid program, and the Medicaid buy-in programs are available in about 40 states across the United States. Next slide. A WIPA project employs Certified Work Incentive Counselors, or CWICs, or CWICs, who provide free benefits counseling and analyze benefits. Some employment networks and vocational rehabilitation offices may also have community partner work incentive counselors, or these CWICs, on staff. The CWICs provide the same free benefits counseling services to their customers. A person who receives a disability benefit from Social Security may visit choosework.ssa.gov/find help and use the Find Help tool to find a benefits counselor. So anyone who is prepared to begin to work, you want to make sure if you receive SSI and or SSDI that you reach out to one of these free benefits counselors to learn exactly what work supports you are eligible to help you towards your earnings and financial goal. Okay, and I will hand this off to you now, Miranda, and
Great.
Thank you.
Great. Thank you so much, Lori. I'm so glad you got to this slide about how folks can access these community partner work incentive counselors, because a lot of the questions in our chat are connected to that. And because we don't provide case management, we can give some general information in responding to that, but you're definitely going to want to be accessing these counselors to talk about your exact situation, because if there's different elements of it that you don't share with us in the chat and we give you an answer, it might not be quite right. So we want it to be absolutely right, Lori?
Correct.
So this is the resource for all of those folks who are asking about SSI, $100,000 limit, 401ks. You know, if you're writing those questions in the chat or the Q&A, this is your resource to really drill down and get more information on how this would impact. And you want to also talk about ABLE accounts when you're talking to them about that. But let's go ahead, and I want to go to the next slide because it is time for us to hear from Tim Elliott, who I told you all about at the very top of the hour when we got started. Just a quick reminder, Tim is one of our ABLE National Resource Center ambassadors who help us. They give us feedback, we share their stories, we include their voices on our presentations because we want to have account owners and family members informing our work and working with us. So Tim is part of our third round of ambassadors. He's a disabled veteran living in Brooklyn, New York. He's a program outreach specialist 1 for New York's Office for People with Developmental Disabilities. He is not under 26. We definitely like highlighting folks who are in their 20s, 30s, 50s because a lot of the misinformation around ABLE is this is something for young folks. Well, certainly start as soon as you possibly can with opening that ABLE account. But, you know, people who are in their 50s, like Tim, can certainly benefit from this as well. And he'll talk about that and how he's using that for himself as well as with the population he serves. So Tim, I'm actually going to hand the floor over to you to tell our audience here today, we've got a good number of folks joining us, how ABLE has impacted your life personally and also what you do in terms of sharing ABLE professionally in your work. Tim?
Okay, can you hear me clearly?
I certainly can. Thanks.
Okay, good. All right, good afternoon, everybody. Of course, my name is Timothy Elliott. Like Miranda said, I'm a disabled veteran. And I've been working, I became disabled in 1991, and I've been working since 2001. I started out with Self-Advocacy Association and then got my job with the state. For me, since I've become disabled, work has been something that I always wanted to continue doing, not just for the fact of being able to provide for the things that I need, but just the fact to be able to give back, because sitting at home, not doing anything, it makes you really kind of regret the situation that you're in, because we all have a talent or a gift. You just have to find what that is in order to give back to the community. So I wanted to work because I knew that I had more in me to give back. So trying to find the right job for me, luckily I've had a lady that was 40 years older than me that helped mentor me in finding a job doing public speaking with self-advocacy. And once I started working, it gave me the incentive to want to do more because I met other people with disabilities that were doing more things with their life. Because when I became disabled, I thought my life was completely over. But seeing other people in my situation gave me the drive to want to do more. And that led to me getting a job, like I said, with self-advocacy. Once I got that job, my dream was to always do real estate. So eventually I went to real estate school and got my real estate license. I did that for about 15 years. Once I got my real estate license, I went back to real estate school and became a mortgage consultant. So at one point in my life, I had about 5 jobs being a person with a disability. There wasn't enough hours in a day to do all those jobs, so I had to give some of them up. Through my job with self-advocacy, I also go out and mentor people with disabilities to go out and try to achieve their dreams and goals that they have. A lot of people that I come across, they also want to work. And my question to them is, what do you want to do? And they'll say, I want to do anything. And I'm like, that's not a goal. Because if you find a job that you don't like, you're not going to be there for long. So you have to sit down and figure out what it is that you want to do and then pursue that opportunity. One of the issues that I had came across with working was that I wanted to save money. But of course, when I started out working, I was still on SSI and SSDI, and that doesn't give you enough money to really live the way you want to live. And you can't save money either because of the restrictions they have on the amount of money that you can have in a savings account. So that definitely holds you back. The money you get with Social Security, it affects your life in a way that you can't live where you want to live, at least not here in New York City, because SSI, SSDI is not enough money for a person to live on their own. Just about the majority of people that have SSI have to live with a roommate, whether it's family members or friends. So you don't have the option of being able to live independently by yourself. You can live independently, but with other people. So having a job where you can earn money just like a person without a disability gives you the freedom to live, have the choice to live where you want to live. Not just that freedom, but peace of mind also, because you don't have to worry about only getting a check once a month and most of that money going towards the rent where you're living at and going towards food, but you have money left over to do the things that you want to do in life. Myself, I love to travel. So, even though I've done more since I've been disabled than I did when I was up and walking. I've been to Las Vegas, Puerto Rico, Bahamas. Now I truly live my life because I have the money to do so. And being employed definitely allows me the freedom to make the choices in life that I want. I've talked to a lot of people that are still on benefits, and they really want to push the issue with agencies, especially Social Security, Medicaid, to do more to give people with disabilities the opportunity to work. It's nice that Social Security has come up with the work incentive programs. And I always tell people with disabilities, people that like to talk on the phone, contact Social Security, see if they have any jobs where you can do those jobs over the phone. The agencies that are providing those opportunities, see if they're willing to hire people with disabilities themselves. I always say that you talk the talk, but you got to walk the walk. Agencies that want to give us those opportunities, are you going to be the first to take that step to give a person with a disability the opportunity?
Tim, thank you.
Oh, sorry, go ahead.
Oh no, I didn't mean to interrupt. I am keeping an eye on the clock for folks, but I think what you're having to share is so important. And I did want to emphasize that in your role, you're working with others, you supervise others, and in your agency, you've been sharing information about ABLE accounts. And I hope everyone who's listening, is certainly any service providers who are listening, if you have an ABLE account yourself or a family member who has one, it's a great way to be able to speak about ABLE accounts and the benefits of them, like what you're hearing from Tim right now, in terms of being able to share it. It's very authentic. We like to see people we trust, who are in positions like Tim's in, to be able to say, hey, I'm benefiting from this, and sharing this with others. Because Tim, just as we're wrapping up with your piece here, you share this with everyone, right, in your agency who could benefit.
Yes, I always talk to people about the ABLE accounts and putting money aside to save for things that they have, things that they want to do in life.
And we're going to get to explaining, because I know lots of people have questions about what's covered under an ABLE account. What can I pay for out of this? We're getting a lot of those questions in the chat. Tim, thank you again for being one of our ambassadors, for sharing your voice and your story on our webinars. Folks, you can check out Tim's blog and his information on our website as well. And with that, I'm going to hand it over to Lori, because I know we've got a number of other slides we want to cover, and we also want to share information we could hear from Kathy in our final 20 minutes here. We're trying to pack a lot of good information in here for folks that they can take away. Any last statement, Tim, for the folks who are listening?
Well, if you're in New York State, one thing to check out is the 55B program, which is the governor's program for people with disabilities that want to work, in the civil service area. That's how I got my job, and the people that work under me, that's how I help them get their jobs also.
That's a great tip, Tim. Thank you. I'm going to hand it back over to Lori to talk about tax benefits and ABLE accounts. Thanks, Tim.
Thank you, Miranda. So ABLE accounts do have tax advantages. That ABLE account, if a person invests a portion of their monies in that ABLE account and there is growth, that growth is not countable income for that individual and it is not taxable income for that individual. Some states offer state income tax or other benefits for contributions to an ABLE account, but the benefits may be limited to contributions to the plan in the contributor's home state. So Wisconsin is an exception, though. Wisconsin does not have an ABLE plan. They allow people to open a plan in any ABLE plan that allows for out-of-state participation, and they do offer a tax benefit for their residents who select that plan for any contributions made to that ABLE plan. So that's a nice feature, but you'd have to live in Wisconsin in order to make use of that. Next slide. What are qualified disability expenses? ABLE funds may be used to pay for qualified disability expenses which relate to the beneficiary's blindness or disability, are for the benefit of that beneficiary, and they must relate to maintaining or improving his or her health, independence, or quality of life. QDEs, or qualified disability expenses, should be broadly understood and not limited. Expenses for which there is a medical, they should not be limited to only things that are medically necessary or expenses that provide no benefits to others in addition to the benefit to the beneficiary. So let me give you an example. A parent opens an ABLE account for their 5-year-old. Their 5-year-old now is big enough that they really need a modified vehicle in order to transport that child in the community. So the parents can access those ABLE funds to purchase a modified vehicle that their 5-year-old child will be making use of, even though that child is way too young to be driving. But that's an example. Next slide. Can you go back one slide, Hope? Okay, next slide, thank you. Okay, so the ABLE savings can be used to pay for out-of-pocket education expenses, for housing. So if a person wants to move into a more expensive apartment than what they have now, or they want to purchase a home, those are allowable expenses. To pay for transportation expenses, employment training and support, assistive technology, personal support services, health prevention and wellness, food, financial management, and administrative services. So like if somebody needs somebody to help them put together a budget and maybe manage their monies on a monthly basis, that's an allowable qualified disability expense that can be paid for out of that ABLE account. And also legal fees, expenses for oversight and monitoring, funeral and burial expenses, and other expenses which the IRS may identify in regulation or policy. Next slide. So due to COVID, we're seeing many more expenses coming to us in our households. So ABLE allows for us to, for example, pay for personal protective equipment. We can pay from our ABLE account for the delivery charges for food, prescriptions, and groceries. Housing expenses for the primary residence, as well as expenses to stay maybe in a hotel to shelter in place in a high-risk situation. Healthcare costs such as deductibles, copays, or other charges, or for private personal care or attendant services. So I've known some people even to open up an ABLE account just so that family and friends could contribute to that ABLE account so that person could then purchase additional attendance services that their Medicaid plan would not authorize. But this is a way to allow for additional services. And COVID-19 specific financial information for people with disabilities is available at https://www.nationaldisabilityinstitute.org/financial-resilience-center. And that site is also offering free financial education tool through LifeSense and access to free financial coaching or counseling services at this time. So you want to check that out too. Next slide. What are some education and work-related QDEs? So job coaching or additional job coaching, job accommodations, home modifications, assistive technology, tools or uniforms, transportation including vehicle purchase, tuition, books and fees, laptop computer, fees for licenses or certifications, dormitory fees, costs associated with self-employment. Next slide. Qualified again. So if you are experiencing these types of expenses, look to no-cost funding sources that may be able to help you pay for those funds so you don't have to dip into your savings within your ABLE account. So like if you need like a laptop to begin your job or to go to college, you might want to approach vocational rehabilitation to see if they would approve you for that purchase. Then you don't have to use money from your ABLE account. As too, assistive technology. If you need a wheelchair ramp up to your home, see if your county now has funding available through the Medicaid program that they would install a ramp to your front door so you don't have to use your ABLE savings. So always look to that, and we have resources available at our website to help you sort of identify where those sources of funding are. Social Security Administration work incentives, such as the trial work period, impairment-related work expenses, the plan to achieve self-support, and the student earned income exclusion can help a person to pay for these things out of pocket, and in many cases retain a higher level of benefits during that time that that person is making out-of-pocket purchases towards their education and employment. And like I said, vocational rehabilitation or an employment network may fund out-of-pocket expenses, or even the American Job Center or Department of Labor might help an individual to pay for something that they need to be able to work. For example, maybe an ergonomic chair or more comfortable shoes. So feel free, you can reach out and we will provide guidance on that. Okay, next slide. Okay. Introducing ABLE to individual employment plans. So service plans that support employment are plans that outline an individual's vocational goal and the supports, activities, and resources needed to achieve that goal. The plan is in writing and agreed upon by the individual, the circle of support, and the service providers who will be providing support towards achieving that goal. So these are usually called like IEPs. An ABLE account can be used to augment these services and supports already available or fund those that are not available. Examples of QDEs include paying for that additional job coaching. So maybe vocational rehabilitation says, okay, we're going to pay for 3 months worth of job coaching, and then we have to cut back on services. So if that person continues to need job coaching services, for example, they could pay for that out of their ABLE account. Maybe the person wants to pay for counseling. So maybe Medicaid will only approve a certain number of meetings with a mental health counselor. Well, that person could pay out of pocket for their counseling services and use their ABLE funds as a qualified disability expense. Maybe the person wants to purchase assistive technology, they need transportation, work uniforms, tools, and other items that public funding may not cover, and they could use their ABLE funds. Next slide.
So Lori, I'm going to take it away from you here and introduce
Great.
Kathy D'Angelo, who I introduced her at the very top of the hour. In our final 10 or so minutes here, we wanted to hear from Kathy and help her, hear from her, have her bring it home in terms of her experience integrating ABLE into individual employment plans with CDO workforce and sharing just some experience there. So Kathy, can you take the next 5 minutes or so and bring people up to speed on what you've been doing with ABLE and what are the outcomes you're seeing?
Thanks, Miranda. I am so excited to be here today. As you said, I work in an American Job Center in Oneonta, and I work primarily with folks who receive Social Security Disability or SSI. And from our very initial meetings, I always start a discussion about finances. When someone comes to our center asking about getting some training or looking for a job, the reason is almost always about needing more money. I mean, many of us on this call are working right now. We're getting paid. Why do we work? Well, we work to better our lives. So even though I love my job, realistically, I work for my paycheck so that I can live independently and comfortably. Folks with disabilities have these same dreams we all have, and they want to be able to take care of themselves. They want to be able to own their own cars or their own homes, to take care of themselves and their families. So we have found that ABLE accounts can really be a big game changer to customers who are looking to upgrade their skills or return to school to train for a new career. I think most of us can think back when we attended post-high school training and how often we received help from our families or members of the community. But before ABLE accounts, these types of gifts could negatively impact services or income that folks with disabilities need in order to live or work and train. And if you can indulge me in a minute, I have a quick sad story which really demonstrates what happens to folks when they fear that banking their money is going to cause them to lose services. I met this young man, Joe, who was working in a community workshop, and he wanted to find a private sector job, and he was able to find a part-time job. And one of his goals was to get his driver's license so that he could get a full-time job and get around because he was in a wheelchair. And Access VR would help him with his driving lessons and adapting the car, but Joe needed to purchase the vehicle. And he knew that if he put more than $2,000 in the bank, it would impact his SSI. So as a benefits counselor, I talked to him about past plans, and I talked to him about ABLE accounts. And I showed him the site, but he wanted to wait until he had some money to put in there. And we talked about it over the next couple of meetings, but he wasn't ready. In the meantime, he met a new neighbor in his building, and this friend was going to be able to transport him to driving lessons once he got them established. And he was really excited about this, and he told his friend that he was saving cash in order to get his vehicle. Well, I think some of you on the phone call can know that what happened to him was very unfortunate, because when he returned home from work about a week later, his apartment was broken into and that money was gone. Even though this friend was arrested, the $1,200 he had saved was never recovered. And I tell this story to underscore that ABLE accounts can also prevent workers with disabilities from becoming crime victims. It's a well-known practice in the disability community to refrain from banking money due to fear of losing services they need in order to work. But I do have a really exciting story of a young lady named Samantha that I want to end with today. And this story started 5 years ago. Sam came to CDO Workforce as a 19-year-old high school graduate with very little work experience and no career plans. She was an SSI recipient, and she told me right at the beginning that her goals were to get a career, get off SSI and get those people out of her life, and to move on and move out of her parents' house and be on her own. She started very slowly with our summer youth program and then into our out of school youth program, where she gained some work experience in some clerical assignments. And it became clear to us that she was a numbers person because she loved creating spreadsheets and balancing accounts and processing paperwork. And all of the supervisors said she worked at a high rate of speed and with great accuracy. We tried to convince her that maybe college was her thing, but she did not think so. But she did take some short-term online accounting and Excel courses, which we provided, and she aced them. She worked in our workforce center in future summers, helping to run the summer youth program. And she also worked in tax preparation offices during tax season. And during this time, she also became a mom. So 2 years ago, Samantha said to us, I need to find a full-time job. I can't do these part-time gigs anymore. I have a kid. And so we helped her look for work, and she was hired by an accounting firm as a front-end clerk. And I talked to her again about National Able Resource Center website. We looked it up. We brought her mom into the discussion. And finally, she did open up an Able account. And she was able to take funds that her mom was holding for her. And I want to mention this practice of having a family member hold your money in another bank account, because that's a strategy that beneficiaries use to save money, but it can't be in their name. But this leads to adult children needing to ask their parents for their own money and not really having control over their finances. It's the same as stuffing money in your mattress or buying a bunch of Walmart gift cards, because none of these will lead to financial independence or stability. But back to our story, Sam started by moving $50 a week from her paycheck into her Able savings. And she also deposited her entire tax refund, including her earned income tax credit for the past 2 years into it. This past August, she had a deposit of $6,800 to put down on a house, and the good news continued from there. Sam gave birth to her second child in September, and she closed on her own home earlier this month. Able really helped Samantha achieve the last of her dreams from 5 years ago. She has a full-time job, which is returning to next week after her maternity leave. She is off SSI, and she's earning a salary to support her family. She owns her own home. I can't wait to watch her establish new dreams. And I am confident that she has the tools to be successful in anything she chooses. I always tell people that I have the best job in the world because I help people make their dreams come true. Every single person wants to contribute to society. We heard Tim say that. Every single person has a gift or talent to share, but they need the tools in order to make it happen. They need money to make their dreams come true. For folks with disabilities, Able accounts can really be the means to fulfilling their dreams and improving their lives. Thanks, Miranda.
Thank you, Kathy. And everyone who's listening, you know, Kathy talks about Able accounts and financial capability with everyone she's working with, and has also shared just even this week at the NIATEP conference for workforce professionals in New York, the best practices they're engaging in with the Disability Employment Initiative in New York. Hey, Alan, I know you're listening. Good job. He's one of the leads in New York State Department of Labor, and we're certainly highlighting a number of people from New York today. Lori came from New York, Kathy, Tim, obviously, but you can see the benefit to this. And some of the questions coming in are around educating others. There's no public funding right now that goes out towards educating beyond what the programs are doing to educate on Able programs. The National Resource Center is privately funded, but if you can help us continue to move forward. In fact, the next couple of slides, if we go to the next slide, we're talking about examples of integrating an Able account in work supports and accommodations. And Lori's going to talk about that, as well as then we've got a few slides just on how to introduce an employer to Able and the resources we have, which are fairly new this year, on educating employers about Able accounts as well, because we do need to continue to get the word out about these. So Lori?
Okay. So an Able account may be used to pay for impairment-related work expenses or IRWs during times when other supports are reduced. it is suggested that a person use that their plan for achieving self-support, the PASS plan, to fund expenses to achieve a work goal. So these are examples of other sources of funding, so you don't have to tap into your ABLE savings. But, you know, sometimes we have to evaluate, can I use my earned income now, or do I need to use my savings to pay for out-of-pocket expenses? Like, let's say somebody needs to purchase something that is very expensive and their regular earnings isn't going to help them to purchase what they need right away. Maybe then they want to dip into their ABLE account, and then they want to get in touch with Social Security Administration, let Social Security know that you made a purchase for that item, and ask, does that qualify for an IRWI? And in fact, I would suggest doing that before you make the purchase. Again, a benefits planner can help you to decide whether it's best to use a work support or to use funds in an ABLE account to pay for expenses. So suggesting it be used for the down payment to purchase assistive technology. And there are affordable loan programs across the United States that can help someone either find resources to purchase assistive technology or to provide a low-interest loan for purchasing assistive technology, and that can save people like $4,000 to $10,000 just on one purchase of assistive technology. So you want to go to that link, including the ABLE account in the individual employment plan. So while preparing an IEP, you want to encourage people to save money within their ABLE account if they are ABLE eligible. And when we do transition plans, we want to encourage youth to have an ABLE account opened in their name that they can begin saving now for their future within their education plan. Next slide. Okay, introducing an employer to ABLE. So next slide, funds in an ABLE account can be used to support an employee's ability to work and increase their productivity. Moreover, funds can support employees around their own disability and or mitigate the time and financial stress they may experience caring for a loved one with a disability. An employer can elevate their reputation as a disability-friendly employer, taking the lead incorporating social responsibility and employee support related to sharing the availability of ABLE accounts as a protected savings opportunity for families who may have a member with a disability. So this is for employers, the majority of their employees have a member who has a disability because 1 out of every 5 people in the United States has a disability. Next slide. So
Lori,
we want employers to inform their employees of ABLE accounts. Take it away, Miranda.
Thanks, Lori. All right. Yeah, I just want to share a couple quickly as we're wrapping up here, and you can have the slides for download. Hope if you could provide in the chat and the Q&A how people can access these slides. They will be posted on our website with the archive of today's webinar. But just to let you know, in terms of introducing an employer to an ABLE account, you can certainly share this presentation with them and the information on the next couple of slides. You can sign up for our Achievable newsletter, and we definitely encourage you to invite your employers to check out the ABLE Employer Toolkit. And these are great resources to share. The ABLE Employer Toolkit has a lot of, easy lift, easy takeaway opportunities, flyers, different things folks can use to share with their workforce. And you can share those with the employers that you may know. And if we go to the next slide, we've been talking about this, how an employer integrate ABLE. So this just provides some information that's included in the Employer Toolkit. And then if we go to the next slide beyond that, there's a lot of educational webinars, resources. Definitely check out that Employer Toolkit. It's the easiest way to just start right off the bat. And the link to that is on our website. It's even right there on the top right-hand side of the toolbar where it says Employers on our homepage, ablenrc.org. But in terms of starting your own ABLE journey, open that ABLE account early. Don't wait until you feel like you have to know everything about it. It's an easy thing to open and learn as you go. And that's one of the things we've heard from all 26 of our ambassadors who are account owners and family members. You don't want to wait until you know this thing inside and out. Open it up and figure it out as you go. It would be the recommendation we hear time and again, because you're going to get the benefits and you're going to figure it out as you move forward in terms of building that better financial future for yourself, for your family, and in incorporating employment into that and benefiting from this. If we go to the next couple slides, really the next few slides just share links to Able tools and resources that may be beneficial to you. You'll see on Able tools and resources, that slide, that we have a service provider toolkit that's coming soon. We've got that employer toolkit, that service provider toolkit, that'll be up next month. So check that out. We've also got a slide on COVID resources, the Financial Resilience Center that we talked about earlier. We do a lot of crosswork between Able National Resource Center and the Financial Resilience Center, both who are overseen by National Disability Institute. Check out those resources for COVID-19 specific information. You can also read some blogs about Able and resources on Able on that site, as well as our own. And finally, we hope you will help us spread the word. More people need to know about Able accounts, and we need your help in getting the information out. So sign up for our Achievable newsletter that comes out every other month. You'll hear stories like Tim's, highlights from people like Kathy, information on podcasts we're doing, other webinars. We've got frequently asked questions. I know a lot of the questions that were in the chat and the Q&A, they're answered in our frequently asked questions page of our website, which we launched back in February of this year. So check that out as well. And we really appreciate everyone for joining us here today. There's a lot to pack in. We can't help but go over by 5 minutes, but we appreciate you all staying here with us. Thank you again to our presenters today, Lori and Tim and Kathy, for the work they're doing. Thank you everyone for joining us. We hope we'll see you on other future Able NRC webinars, and that you'll keep engaging with us and move forward. We look forward to hearing about your own stories and wish you success with that, and tying employment and these great resources in with your Able account and getting the best maximum use and benefit out of them. So with that, I'll end us for today and say thank you. Please do take a moment to complete the post-training survey that Hope has provided and give us some feedback on your experience here with us today. We appreciate that and build our work off of that. So thanks everyone, and enjoy the rest of your day.